Okay, wonderful. All right, great. Thanks everyone for joining us. We have a great speaker today who I asked to come every year or so because she's so good. Tricia Catiggay is an occupational therapist, has worked for Stanford Healthcare on many, many bases for a long time. Um,
Yes.
and she is such an expert about fall prevention, and also she knows all about Stanford's fall prevention um, programs and services that are available. So that's why I have asked her to come talk today. And it was just interesting. I read today on that. I know you often talk about celebrities who have fallen. And I read today that the Kiss
Oh,
band member, I don't know if any of you are Kiss fans, who are probably not the right generation to be Kiss fans, but maybe somebody out there is. But Ace, I think his last name is pronounced Freely. He died just a couple days ago, and it was announced today that he died after a fall, due to a
oh.
fall. So add that to your celebrity list. Although again, I don't know how many people know about Kiss, but okay, great. Well, take it away, Tricia.
Okay. Well, thank you all for having me here. So, Robin asked me to talk to you about falls and fall prevention. So, here we go. So, I wanted to talk to you a little bit about facts about older adult falls. So, you'll see there on the screen that every 20 minutes, an older adult dies from a fall. And that let's see, 1 in 4 older Americans fall every year, and that twice or 2 times older adults who have fallen have the chance of falling again, and usually within a year of their first fall. You'll see that 1 in 5 falls results in head injury or broken bones, and then there's a significant amount of money that is spent on treating our older adults who have fallen. You'll see there $744 million total amount spent for acute care charges associated with older adult falls in 2014. So this is in 2014. So, and I think that that number has only increased. In fact, I saw some recent statistics for 2024 or 10 years later that looked that it was in the billions now. Um, so let's take a deeper look. So falls represent the most frequent and serious type of accidents for people age 65 plus. And that is the largest reason why older adults go into the ER is because of falls. But falls are not an inevitable part of aging. I mean, there are a lot of things that we can't control. Yeah, we're getting older. That maybe if we have neuropathy, we really can't cure neuropathy. But just because you're getting older, it doesn't mean that it's just a fact of life that falls are going to happen. But the reason why falls happen are these intrinsic factors and extrinsic factors. So, intrinsic factors are changes within our body, and the extrinsic factors are environment and behaviors. So, our intrinsic factors might be, we're getting older, we might have neuropathy, we have vision changes. And then those extrinsic factors are environment. So, in our home, in our community, how we behave, like are we wearing flip flops? Are we not being mindful? So, those are the factors that go into why um, the reason why falls could occur. So in reality, the reason why we fall are usually due to a combination of factors, not just oh, I don't have good strength, so that's why I'm falling. It is a combination. You got to take a look at the whole, like your vision, take a look at what your behaviors, so, the best way to reduce falls is using a multifaceted approach. And you'll see this pie that has equal pie slices of exercise, medication review, and home modifications. So you want to take a look at health factors, our behaviors, our vision, hydration. So making sure that we drink enough. And of course, looking at alcohol, because sometimes drinking alcohol will affect our balance. So, what can you do to reduce falls, or what do you have control of? Well, exercise. So, doing exercises for strength, balance, flexibility, endurance, and mobility are important to reduce your fall risk. And here are just some samples of exercises for flexibility, strength, and balance. So you'll see on the left, you have ankle circles. I always like to teach people ankle circles because if you think about it, the ankle joint is the first joint that detects and responds to change in the terrain. So it's really important to have good flexibility, good strength in the ankles. And you can do that sitting, you can do that standing. The middle picture shows somebody, or the top picture are leg lifts, or I should say like foot lifts, so that you're just lifting the foot and straightening the knee. And I always tell people when they do these leg lifts is to do them slow. Don't do them fast. Sometimes um, we want to do exercises fast because we want to get them out of the way and to have tick that off that we've done that exercise. But we do want to take it nice and slow and as much movement as you can tolerate. The other picture that's on the bottom is marching. So you'll see just lifting the knee up to the ceiling. And again, you can do marching in seated or standing. And again, I like doing them nice and slow. And then the last but not least of the exercises on this particular slide is that sit to stand. That's one of the best exercises for strength and balance. And again, rising. And then when you sit down, sit nice and slow as if there's an egg on your chair and you don't want to crack the egg. So you want to make sure, again, nice and slow. You don't want to use momentum. So those are just some sample exercises that you can do for flexibility, strength, and balance to avoid falls.
Tricia, is that
Yes,
first one on the left, is that a ankle flexion up
yes.
and
Well,
down?
oh yes, you're right.
Okay.
I kind of honed in on that bottom picture. Thank you,
Yeah.
Robin. So that first top picture is the ankle going up and down, or the foot, the toes going up and down.
Oh, okay, yeah.
Yes,
Right.
that's it.
Yeah.
And then the bottom picture are the ankle circles.
Okay.
Yes,
Just
you're
want to
right.
be
Thank
sure.
you. Yeah,
Okay.
yeah, yeah. So those are all important. Sometimes, people have had ankle surgeries or limitations in their ankle, so it's very difficult to do ankle circles. So doing the ankle or the toes up and down to kind of get the ankle warmed up sometimes really helps too. And that also helps with circulation. Sometimes people have edema or swelling in their legs because of the medications that they take or certain conditions that they have, and so they have swelling of their lower limbs. So doing those ankle pumps, I like to call them, that top picture that's on the left, doing ankle pumps are really helpful because there is a circulatory pump that's in the front of your ankle. So we do recommend that if you can to join a community exercise program. Tai Chi is really good, especially there's a particular Tai Chi called Tai Chi for better balance. I think that when they put this program together, it was specifically for people who have Parkinson's. Taking dance and fitness classes like Silver Sneakers or Sit and Be Fit. I think Sit and Be Fit comes on public TV. I think in my area, Channel 17, and at 9:30 in the morning every day. So sometimes I do Sit and Be Fit. Sometimes people have videotapes of that or DVDs. Doing line dancing that helps with balance too. Then you also have your virtual programs. Age Bold. Now I can't remember, I didn't check Age Bold. I know that came about when the pandemic happened, and I'm not sure if they're still around. I think they are still around, and they do they will help you put together a personalized exercise program for yourself. You can check YMCA. There's also, if you are a member of the YMCA, there's YMCA 360, which they have different virtual exercise classes that you can take on demand or when they have them scheduled. And also taking regular walks is really, really important. There's also other community fall prevention programs, and I'll go over the three actually that we provide. But there's Farewell to Falls, there's Matter of Balance, Bingocize, and SAIL, which is Stay Active and Independent for Life. Those are evidence-based fall prevention programs, and also sometimes your local senior center may have a class that's specific for balance. So check them out. But I will talk a little bit more further later on in the presentation on what we offer, which is Farewell to Falls, Matter of Balance, and Bingocize. So another way to reduce falls is to talk with your doctor about falls. Now, sometimes people are a little hesitant because, oh, the doctor may take away my license or may say something about I'm not going to be able to live in my own home. What you want to keep in mind is you want to partner with your doctor to investigate, why you may be falling, and they want to keep you independent too. So the things that you want to make sure that you talk to your doctor about is to have a medication review, to talk about, to see whether there are any interactions with your medications. Of course, check your blood pressure, um, check your vitamin D, and that's usually done through a blood test. And if you feel like you need it, if you find that maybe there are more problems with your walking or balance, see if you can get a referral to physical therapy, whether it's through home care. And in order to get home care physical therapy or even occupational therapy, you have to be homebound. So, so you'll get home or outpatient. And then, of course, occupational therapy for a home safety assessment or to help with activities of daily living. And sometimes, people will say to me, I've had physical therapy before, maybe, 2 or 3 years ago. I'm not sure if my doctor will order physical therapy for me again. Well, I always tell people if there has been a change in your function, maybe now you're needing to use a cane, whereas you didn't have to before, or maybe you have to use a walker now, whereas prior to when you saw your physical therapist several years ago, you were using the cane. So if there has been a change in your walking status, in your functional status, then do talk to your doctor about getting a new referral for physical therapy or for occupational therapy. Medications are also a risk factor, and as many as a third of all falls in older adults may be related to medication problems, the medication itself, and maybe the interactions of the medications. You'll see there that taking 4 or more medications increase fall risk, and they don't only just count your prescription medicines, but they also count your over-the-counter medications. Like if you take aspirin, or if you take Tylenol or ibuprofen, um, um, Dulcolax. So when you have a medication review, you want to take a look at all those, including your vitamins and including any herbals that you take. Sometimes people take echinacea or ginkgo or turmeric for health reasons, but that is also counted in that 4 or more medications that could increase fall risk. So that's what I just said in a long version of the third statement that's there, that you do want to take your prescription over the counter vitamins and herbal medications to your doctor or to your pharmacist for review. Ask your doctor or pharmacist, I mean, what is this medication used for? And what does it do? What time should I take it? There are certain times of the day that medication, when you take it, it's much more efficient or it has better efficacy? What side effects might I have? Sometimes it's hard, when you do get your medications, you get those pages and pages and little letters that tell you every single thing that can happen. But to hone it in when you do talk to your doctor or pharmacist on what side effects that I could have. Will this medication interact with any other medications that I am taking? And how long should I use it for? And when should I expect it to be effective? So these are all good questions to ask your doctor or your pharmacist as you do a medication review. Oh, okay. The other thing is what another way to reduce your falls is to adopt healthy behaviors. So it's very important to have your eyes and ears checked regularly because if you can't see something, you won't be able to avoid it if it's in your pathway. So that's why I really recommend people get their eyes checked on a regular basis. Make sure you wear well fitted and secure shoes, and you'll see in the picture that the lady has footwear that looks like it has really good support, thin soles, and a back to the back of it to fit well. You want to limit your alcohol use. Sometimes medications will affect you and the use of alcohol at the same time. And reach out to family and friends for help when needed. It's very important to be assertive to let people know what you need. And your actions matter. So if you take a look at this picture, what are the danger zones here? Or what's happening here that could cause a fall? So you'll see shoes, climbing on chairs, and ladders and other behaviors can increase fall risk. So you'll see this person is standing up on a chair and leaning, and you'll see there's a dog at the bottom of the chair. So maybe if she steps down, if he's in the way, um, she might trip over him. So, so here are 5 quick and easy modifications that you can do to make your home more safe. So you'll see for number 1, that's a bathroom. You want to, if you need to, you can get a shower seat, grab bars, an adjustable height handheld shower. So that will make bathing easier for you so you don't have to do any overreaching. You want to make sure you have good lighting. As we get older, our vision diminishes a bit and we need more lighting. You want to make sure that you replace your burnt out bulbs with bright, non glare light bulbs. Have a sturdy chair in your bedroom so you can sit while getting dressed. I know sometimes people will tell me, well, I lean up against the wall to put my pants on. Much more safer to sit in a chair because I've had people also they sit on the edge of the bed and sometimes the bed is a little high and you can slip while you're getting dressed. You'll see there for number 4, and it targets the stairs to clear the way. So keep items off the stairs, remove clutter, and throw rugs from the floors. Sometimes on the stairs, I'm looking at those stairs now. If there's a landing, people will put like plants or statues or decorative things there. But I always like to tell people to clear that out, so it's just a clear pathway for you. And then number 5, store for success. Keep those frequently used items between waist and shoulder height and try not to use a step ladder. And of course, if you do need to use a step ladder, make sure that you have one that's sturdy, that has a little rail to hold on to. And you'll see this comes from the National Council on Aging and from USC. So 5 quick and easy home modifications to make your environment more safe. And here are some other hazards. So you'll see the picture on the left, some of the hazards there. I see a pillow that's in the pathway if someone was to get off out of the bedside on that side. And the quilts that are puddling on the bottom of the bed, that's a trip hazard. And then with the picture on the right, you'll see this person wearing those, I call them scuffs. So not very supportive footwear because your foot, when you wear those scuffs, your foot can slide in them. One tends to shuffle a little bit more because you're trying to keep the shoe on your foot or the scuff on your foot. That rug is crumpling up and can be a hazard. And it looks like she's like really big steps, so maybe she's hurrying. So maybe she's trying to get to the bathroom. So again, that's a behavior that we need to change to not to hurry, to take your time, to be more mindful. And I think, oh yes, here's another room. I think this is a living room or a family room. And what are the hazards here? So I see the lamp cord that's running across the pathway. It also looks like at the foot of that leather couch, that looks like weights. So that's a tripping hazard if you were to get up um, on that side of the couch. And it's narrow. I can see, where that trunk is that's in front of the couch. Looks like that's kind of a narrow pathway. So I would probably push that out a little bit more. And I see the shoes that are on the newspaper. I'm not sure. I'm thinking maybe if you were to put your shoes on, that's not a good place to stand and put your shoes on because they could, as you're trying to balance and slip your shoes on, they could slip on those pieces of newspaper, and there's nothing to really hold on to. And I see that cane that's on the ground. That's also a hazard because it's in the pathway. So just a few hazards here in this living room, family room. More hazards to look at. So here we are on the left. This is someone's front yard. There are several steps there. It looks like there isn't a banister to hold on to. Of course, the biggest thing I see is that cord that's running across the pathway. And you even have some plants like that, bushes that are kind of in the way. That maybe as you're trying to push the plants away, so because you're walking through, maybe you might lose your footing because it looks like on the bottom of those stairs between the different brickwork, it looks like the pavement is rising a bit. So that's an uneven pathway, and you can scuff your toe on that and trip. So that's what I see there. It looks like the door, the pathway to the door is pretty open, but again, nothing to really hold on to. And then on the other side, on the right side, with the gentleman looking at the book, I see that there is that cord running across. Let's say he has to, oh, I got to get up and I got to use the bathroom, tripping over that cord. So I don't know if there's anything else that you all can see. So hazards everywhere. So what happens if you do fall? Well, have a way to call for help. Now, some people, they have one of those life alert, and life alert comes, in a necklace or in a watch style. And there's, I remember, gosh, it has been um, almost 20 years since I worked in fall prevention. And I remember life alerts were only that one kind that was in your house. And only you if you weren't outside, or maybe if you were further along in your yard, it wouldn't cover you. But now there's such a plethora of different types of life alerts with GPS, with a you can talk to somebody if you talk into your device. So um, have something like a life alert, or carry make sure you carry your cell phone with you, or have sometimes people have fall detection on their Apple watches or on their Samsung watch, um, that will alert if you've had a fall. Have emergency numbers posted. Practice getting up from the floor, or have a plan if you do find yourself on the floor. I remember, this is a long time ago, but one of my colleagues had a patient who had a telephone on the floor, like in the bathroom, in her bedroom, because if she landed on the floor, she would be able to get to the telephone. And of course, what you want to do is make sure to prevent a fall so you don't get into trouble like this gentleman here. So what are your next steps now that you've heard about, falls, and how important it is for us to address them, because it's rampant, and as we get older, but prevention is the key. So what are your next steps? So consider your risk for falls. Do a home safety check. Add at least one exercise to your routine. And there is, let's see, I think it's the next slide. Yeah, there is the National Council on Aging, and some of you may have seen this before, is this sheet that sometimes the doctors give to their patients on checking your risk for falls. And you'll see that there's these different statements, like I have fallen in the past year, or I have been advised to use a cane or walker to get around safely, and you'll say yes or no. And you'll see on the other side, it says, why does it matter? And what you do is you take this little checklist and you total up the number, and you'll see that you want to add up the number of points for each yes answer. And if you've scored 4 points or more, you may be at risk for falls. So you can discuss that with your doctor. It's a good talking point to talk about what can you do um, to prevent. Sometimes too, like I had one situation where um, uh, oh, we were talking about assertiveness, and making sure you tell if you have symptoms, to tell your doctor everything. And I had one gentleman who said, "Oh yeah, I didn't tell my doctor this. I mean, he gave me this medication because these were the symptoms I was having." So when I went to see him again, I told him, "Oh yeah, and I've also having this happen." And his doctor said, "Oh, then I'm treating the wrong thing. I'm going to send you to a specialist." So then like I felt really good about, yeah, I should tell my doctor everything, because you do want to investigate that there might be a physical reason behind why you might be falling or be a frequent faller. So you do want to rule out those medical conditions. So fall risk screen. So think about for today, based on what I talked about, think about making at least one change from something that you've learned today to make you more safe. Now, I know sometimes change is hard. I'll give you an example. I mean, for me, I really love wearing flip-flops, but I know that's not good for me because I'm at more risk for falls, especially if they're not moving really well, or I move too much. And so I had a certain pair of flip-flops that I liked, but I noticed that when I was walking in them, that my foot slid around a bit. And I thought to myself, Tricia, you probably shouldn't wear these flip-flops. You should get rid of them. But I remember it was really difficult. You'd think, oh yeah, just get rid of them. Use something else. But I know for me it was really difficult because they were cute. I bought them on sale. They were nice looking. And I think it took me maybe a near fall that I decided, you know what? it's not worth it. I need to just get rid of these. And so I did. I know sometimes change is hard, but sometimes change is easy when you want to think about to be as safe as possible. So let me talk a little bit about what we offer. So what we offer in our department, which is injury prevention, and we do have several fall prevention programs. Our first program is called Farewell to Falls, and I don't know if you've heard about it before, but it is a free in-home fall prevention program for older adults over 65 who live in the Santa Clara, San Mateo counties. And you don't need to be a Stanford patient. I've seen people who are Sutter Health, I've seen people on Medicare, people, it doesn't matter because it's free as long as you fit within the parameters of, being over 65, although sometimes I've seen people younger than 65, and that you live in the Santa Clara, San Mateo counties. So what happens when you enroll in Farewell to Falls? Well, an occupational therapist such as myself will come in for 2 visits. We will ask you about your falls, ask you about your health, also ask you about fall concerns because people who've fallen, or you may know of people who've fallen who've had serious injury, there may be concerns about falls, like, oh, I'm a little nervous while walking in my neighborhood, or I'm nervous taking a shower, or I'm nervous. Cooking in my kitchen. So we do want to talk about your fall concerns. I also write down your medications. So I write down your prescriptions, your non-prescriptions, your vitamins, your herbals, and what I do with that list is I take it to we have a Stanford pharmacy resident who will look at the medications, and you will get a report that will say drugs that may increase the potential for falls. Are there any drug on drug interactions? Are there any drug and food interactions and any kind of safety things related to medications they will address. So that's why I query you about your medications. Sometimes people will say, "Oh, can you just look at my health and just take my medications off of there?" I I really like to talk to people about their medications because sometimes what's on my health doesn't match with what they're actually taking. Like sometimes when they give me their list that they print off of my health, I'll go through the medications. I'll say, "Oh, you're still, oh yeah, we took that out," or "I'm taking this instead of this," or so. I really like to talk to people about their medications. So and then we also do um, 4 standardized assessments on balance, strength, and mobility. So usually I do that during the first visit, and then we have a second visit, and the second visit, which is usually about a month or 5 weeks after that first visit, I'll have the pharmacy report from the pharmacy resident. We go over it. Then I give it to people so that they can have and review it with their doctor. At that time, I usually do a home safety assessment. So, looking at shoes, whether you have pets, do you have grab bars? Do you need grab bars? Um, so, and then, it's written out, and then we give you our recommendations regarding home safety. Sometimes it's nice to have, a third eye. You may live in your home for, 20 plus years or so, and so you're used to things. So it's really nice to have a third eye come or second eye, I should say, take a look and make you more aware of, oh, well, this could be a hazard. And I don't like to go to people's homes and, take rugs up. I don't do that automatically. I kind of take a look at what kind of rug you have because sometimes you do want to have a rug that's under your kitchen sink because if you're doing dishes or washing your hands, sometimes water splashes on the floor and you don't want to slip on water that's gotten on the floor. So, sometimes having a rug there, I mean, it's fine as long as it's one that's not slippery, that has a non skid back on it, or rubberized matting on the bottom of it. So um, home safety assessment. And then what I like to do is the next bit in the second visit, and sometimes I do this in the first visit too, is talk about exercise. Um, some of the research regarding older people and exercise, and what kind of exercise could we recommend. And sometimes I see a lot of people who already exercise, and sometimes I give a little tweak. Oh, add this to your exercise repertoire. Um, so that is the Farewell to Falls program. And then um, there's a third visit, usually a year later, and it's more like a follow-up visit. We talk about, any changes in your health, any changes in medications. Have you had a fall? And let's take a look at your balance, mobility, and strength assessment that we did last year. And, are there any changes from that? So that is our primary um, program in fall prevention. It started, next year is going to be our 20th year anniversary. And, this program came about because that's the reason why older adults go into the ER. They've fallen. And so this program got started by a grant by a private company. And actually, 2 years into the program, the grant ran out, and we weren't sure whether the program was going to continue. But because people in the community felt that they got good information, the program, it's now a community benefit. So again, at no cost to people, and it's free. The second program that we have available is called Matter of Balance. And so this is a class. It is an evidence-based fall prevention class that is geared toward the older adult who may have a fear of falling, because what we know is that the fear of falling or concerns about falls is also a risk factor for falling. Sometimes the fear of falling is so profound that people, stop doing the things that they enjoy doing. And in doing so, they really limit their world, and they may lose strength, may lose balance because they're not getting out and being as active as they are. So this is what this program addresses. So you'll see there that the program utilizes a curriculum that includes lectures, group discussions, sometimes role playing, and other techniques, as well as regular exercises as part of each class session. So what we found out is that, or the research shows that when we take a look at fall prevention, you not only just look at the physical factors. The physical factors are important, like balance, working on your balance, strength, but there are these mental skills that we want to put into place, like I spoke about earlier in this slide presentation. Being assertive, making sure you don't engage in risky behaviors that could make you more at risk for falls. Um, so, so we talk about those topics also. Um, some of these negative thoughts that, oh, I can't do that because I might fall. I'll stop going to, I have season tickets uh, to the theater, and I'm not going to go anymore because I'm afraid I'm going to fall. Well, what is it that you can do to plan ahead so that you reduce your risk for falls? And in fact, I just saw somebody last week who told me her physical therapist told her about the three P's. So the three P's are to pause before you do an activity, to plan, and to proceed. So I thought, oh, hey, that's pretty good. so so participants for this particular program for Matter of Balance, they meet for 8 2-hour sessions, and that's usually at a community location. And so I do have classes, like I just finished a Matter of Balance class in Cupertino Senior Center just last week, and a class in Mountain View. just finished also. So I'm in the process of looking at for 2026 doing another class of Matter of Balance in San Carlos, in Belmont, and possibly looking at Sunnyvale and Mountain View again. So that's my planning as far as 2026 for Matter of Balance. The other evidence-based program that we have is called Bingocize. So you'll see it. This is our third program, and that's played twice a week for 10 weeks, and it combines the game of bingo with exercise and fall prevention education. So this came out, I would say maybe 5 or 6 years ago, especially targeting those adults who are not very active but like to play bingo. So you play bingo and it's like you even win prizes. So bingo for some people is fun, it's familiar, and the program has been shown to increase older adults' functional fitness, health knowledge, and social engagement in a variety of settings. So that's Bingocize. And I think what I can remember as far as Bingocize is concerned, they've just finished a class in Menlo Park at Little House, and they're hoping to have another class possibly in Cupertino in 2026. So that's the most recent knowledge that I have. So you'll see that there is a QR code if you want to scan that and get more information. But you'll see on the bottom, if you are interested in any of these programs, Farewell to Falls, Matter of Balance, or Bingocize, you can give us a call. There's also an email address if you want to get more information, and even on the web. And I think this is recent information. I was just told, looks like since May. So if you are interested, please contact us through those means.
And Tricia, could you give an
Yeah.
example or two of how bingo size works? So what, for example, would be on the bingo card?
Yeah. So the bingo card, from what because see, I'm not as active with Bingocize as I am with Farewell to Falls and Matter of Balance. So what's on the card is just like a regular bingo card. The letters and the numbers. And
Yeah.
so what they do is they'll call out. So if they whirl the wheel and they'll call out the number, and then you place your little bingo card or your bingo chip, or I don't know exactly what they use, and then you put it on your bingo card, and then you might have you talk about a fall fact, or you ask questions of your participants, a fall prevention question, and then you stand up or you sit down and you do a particular exercise, and then you sit
Okay.
down and then you whirl the wheel. And then
Okay.
so it's like regular bingo, but
Just like regular bingo, but just
yeah,
a little bit of movement worked in and
yes,
conversation about exercise.
exactly.
Okay, cool. All right.
Yeah, exactly. And I think that's why people enjoy it. In fact, was it, I can't remember if it was last year or the other year, they were running a lot of bingo size classes, and it would be the same people who would sign up every time because it was so much fun, and we were trying to expand it out. But yeah, I've heard that it's a lot of fun.
Yeah, I walked by the
Yeah.
one at Little House
Yeah.
about a
Oh
month
yeah, yeah,
ago,
yeah.
and it was a very noisy, active group. It was amazing. Everybody was quite engaged.
Yeah, you can see it. It
Yeah.
can be. I mean, we tried, I think one time, trying to do it both at the same time, both virtually and in person, but that didn't work as well. So I think what they're trying to plan for is, for bingo sites to have it in person, just like you saw at Little House. But
Right.
it is quite engaging because
Hmm.
people really get into the prizes too.
Yeah, right.
Yeah, yeah. So it is a lot of fun.
And the leaders, there it seemed like there were two leaders, and they
Yes.
were both, on the younger side
Yeah.
and very, very. energetic and good with seniors, and I thought it was nice.
Yeah, yeah, yeah. So in particular for Little House, what we contracted them is that we were providing one of our staff to be one of the coaches, and the other staff was their staff who got
Oh, okay.
trained in it.
Perfect.
And yeah, yeah, no, yeah. So probably, also to someone, who's a staff person there at Little House, and then they're familiar with the people
Yeah.
there.
Yeah.
So it can make it more engaging, or they know them. Yeah. So it is a lot of fun. The problem is sometimes with this, um, you'll notice it's 10 weeks for twice a week. And
Mm.
I can't remember off the top of my head if there's a um like you have to be able to go to most of the classes. I don't know if they have a set number, but sometimes having it twice a week for 10 weeks can be hard. That's what I've heard.
Mhm.
Yeah.
Yeah. Okay.
So that's what one of the that's not, I don't say call it a downside,
Yeah.
but
Whereas Matter of Balance, you said, is 8 sessions,
yes,
and it's once a week
yeah, and that
over
goes
8.
by really quickly. I mean, in the
Yeah.
beginning, like that second session, third session, you think, oh, 8 session, that seems like a lot. But then, once you get to fourth and fifth, it accelerates. And then before
Mm-hmm.
you know it, it's done. And so,
Mm-hmm.
like I know for both Matter of Balance and Bingo Size, because they are evidence-based programs, they are it. There isn't a Matter of Balance part two. There isn't a Bingo Size part two. And that's what sometimes people will ask me, like, oh, um, uh, Matter of Balance, is there, if I want to take it again, it's going to be the same exact class. And I think
I
it's the
see.
same for Bingo Size. It's the same exact. So sometimes what we tell people, now that you've gone through Matter of Balance, now that you've gone through Bingo Size, it sometimes it kind of opens the door for people that, what else can I take?
Right.
Like, signing up at doing a class at the YMCA, or signing up for a class that at the senior center, whereas maybe I wouldn't have thought of it, that maybe
Right.
might be too much. But
Yeah.
now, like I said, it opens the door, and we recommend people to do other classes like sail. Now, I
Mm.
know, I don't know any places close by that does sail. I know,
Mm.
which is exercise only. I think it showed up in the pre not slides a few back, but that's
Yeah.
also an
Yeah.
evidence-based program. That's all it is. It's just exercise, and that's it. There's
Mm.
also another evidence-based program that's just exercise, and it's called Enhanced Fitness. And I remember there, I don't remember Palo Alto YMCA if they did enhanced fitness. This was before the pandemic. So,
Mm. Mm.
I'm not sure. Sometimes some of the senior centers will do enhanced fitness. I mean, I live in San Mateo, and um, um, at the local Y that I went to, they did enhanced fitness. I don't know if they're doing it now, but they were doing it prior to the pandemic. So there
And
are,
that's evidence-based, you
yes,
said.
and evidence-based, meaning that
Okay.
they've had some research behind it, and there's a
Right.
certain way that they teach it. And so that's why
Yeah.
when you think about evidence-based, well, what does that mean? So you have to follow like the fidelity of the program, especially like for Matter of Balance. Like sometimes people will say to me, um, can I only do an hour each week, or can it only be 7 sessions? Well, I really can't do that, because that's going outside the fidelity of the program. So sometimes
Right.
with these evidence-based programs are a little bit more limited, because this is the program and this is how
More
we run
strict.
it.
Yeah.
Yeah. So
Yeah.
for both Matter and Balance and Bingo Sites, we are operating under their license. So
Okay. Yeah.
yeah,
And
yeah.
on under Matter of Balance, is Matter of Balance both education, so someone's talking, and
Yes,
also some exercise or movement incorporated in it, or is it?
yes.
Yes. Okay.
Yes.
Just
So,
both.
but a more so Matter of Balance is a little bit more is more group discussion and problem
Okay.
solving within the group. So your
Okay.
coaches, there are two coaches, and I look at them as more facilitators. And so
Mm-hmm.
there's certain topics. So let's say the topic is, I'm going to say assertiveness. So the facilitator might say, okay, what is assertiveness and why is it important for fall prevention? And then people will talk and they
Mm-hmm.
will problem solve with each other. They will say, oh, well, try this or try that. So and it is directed by the coach, but it is
Mm-hmm.
sometimes people will say it sounds like it's a lot of like group therapy. In a way,
Yeah.
it kind of is because you know what? People learn from each other, and
Yeah.
they don't want to have information spoon fed.
Yeah.
You kind of you get information, right? And you kind of try to apply it to how does this affect me, or how can I make this work in my situation? So we're
So
talking
how
about, yeah.
so how is assertiveness related to fall prevention?
Very good question,
Well,
Robin.
you opened it up,
I
so
opened, I knew, I walked that right in. So
you
sometimes
did.
I did. So what a lot of times I'll do is sometimes I say, well, what do you think? I'll tell people. But this, let me tell you my thoughts as far as assertiveness. And it actually is a situation where um um I had somebody who fell and they were extremely embarrassed. And so she told her friend, "Oh, and they were at a they lived in a senior apartment. She told her friend, "Oh, help me get up because I don't want to tell anybody. I want to get up." And her friend who was with her said, "Oh, shouldn't we tell? I want to make sure you're okay." And um uh, you have somebody else help you. She said, "Oh, no, 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 no. I want you to help me." So the person who felt uncomfortable helped her friend get up. I mean, fortunately, she was okay. But later on, she said to me, I was a little nervous because what if she was hurt? And if I got her up, what if she got hurt more? And I'm older myself. What if I got hurt? So
Mm,
in that situation, I think it's really important to be assertive and let people know what it is that you need. I mean, I had a situation where I was coming from a friend's house and it was a little wet and it was dark and she had these steps like almost they look like they were marbly steps, and she didn't have any rails. And I was feeling I was going through a period where I was having a little vertigo, and
mm,
I saw those steps, and I thought, oh, I'm not sure if I can get down these steps, but I can do it. I don't. I'm embarrassed. I don't want to ask anybody for my help. But then I thought, what if I fell? That would
mm,
not be good to fall on marble steps because it's gonna hurt. So I just had to, and I was younger, but I said
mm,
I asked somebody that I didn't know. I said,
mm,
"Can I just hold on to your arm a little bit? I just feel more comfortable holding on to somebody when I got down these steps." And this person was like, "Sure, I don't mind at all." And so I think it's these little things that we need to do in order to help ourselves, to make our needs known, to be more safe, um, to feel assertive, to, like I said, to make your needs known. So that's
yeah.
when I think about assertive,
Okay. I like
is
that.
doing that. Yeah, yeah,
Yeah.
yeah.
Yeah. Nice.
Very good question. Good
Well,
conversation.
you set it up.
Yeah, no, it's okay. It's all right because this is the end of my presentation. So I didn't know if anybody had any questions, or Robin, if you have any more questions, but I thank
Well,
you
I
for
asked a
having me.
lot, but listen, if
Yeah.
anybody has any questions, you can use the chat or the Q&A box. Either one will work. Let us know if you have any more questions.
Yeah.
And so, it sounds like the 2026 schedule for both matter balance and bingo size are being determined now.
Yes. So
Yeah.
right now I do have, let me see, let's see if I have it. I do have a date for Matter of Balance at San Carlos in 2026. It's going to start January 13th.
January
Every
13th. Okay.
Yeah, every
Okay.
Tuesday from, I think, because I'm trying to do this off the top of my head, um,
Hmm.
10 to 12. And we're
Okay.
asking people to call the senior center directly if they have information, if they want more information. Or, you can even call us to
Yeah.
to get more information. But I think it goes from January 13th through maybe March. I want to say March.
Yeah, sounds like it would be if it's
Yeah. And
eight
and
weeks. Yeah. Hmm.
yeah, and then for Belmont, Twin Pines, I'm
Hmm.
hoping to have a class there starting in March, and those are dates to be determined. And
Okay.
like you said, as far as bingo size is concerned, again, dates to be determined. But
Right. Okay, very
yeah,
good.
yeah,
And just to follow up with either the senior center or for specific dates, follow up with Farewell to Falls, the
yeah, you can
phone
call
number and
the
the email.
number there,
Yeah,
yeah, because
right.
I think that goes to all our programs.
Right. Okay,
Yeah.
perfect. Okay, does anybody else have any other questions? Um,
I'll keep this up in case people want to write that down.
Okay, sounds good. And I think all of the programs, all three programs that Stanford is involved with are fantastic. I really recommend Farewell to Falls to
Yeah,
everybody.
yeah,
It's, as Tricia said, it's a free program. Wow, you get 2 occupational therapy visits into your home, medication review, home safety review, written list of recommendations for home safety, and then that 1 year follow-up.
yes.
It's a fantastic program. Free. I mean, you can't beat it. And only
Yeah,
have
it's unique. There's nobody else that's doing it.
yeah,
So
it's so pretty.
we're
Yeah.
we're lucky that we live in this area and we have access to it. And you don't,
Yes,
like I said,
indeed.
you don't have to be a Stanford patient. You can be,
Right.
yeah. And you
Yeah.
can self-refer. You don't even need a doctor's referral. I mean, we do have a lot of our Stanford doctors who refer their patients, but people will call and said, "Oh, my neighbor got through this and it sounds interesting. I would like to join." And
Yeah.
we'll
Yeah.
set something
Right.
up. Yeah.
Yeah. And speaking of a doctor, does a doctor need to um, certify or say somebody can attend Matter of Balance or Bingo Size?
No, no.
No. Okay.
What we do is that we do ask people that are you okay to exercise? We do
Okay.
a fit what do they call it? It's like a physical readiness yes or no, like do you have chest pain if you exercise?
I
I mean,
see.
do you
Uh-huh.
do this, do that? So a lot of times people already have already talked to their doctors about whether
Right.
they can exercise or not. And usually they fill out that questionnaire and they're okay to do exercise for matter of balance. Like you were asking about the discussion part and the exercise part. For matter of balance, the first 2 sessions are more discussion, and then they do exercise starting at the third session, and then every session thereafter, from session 3 to session 8, they're going to exercise every single time. So
Oh,
they'll do
okay. Uh-huh.
discussion and exercise. Now, sometimes people say, "Oh, why don't we exercise at session 1 or session 2?" Well, again, matter balance, the way they've set it up is they feel that there needs to be this um, building blocks toward
Hmm.
going toward exercise, that they want to do the exercise session first, so that each session builds on each other. So, I mean,
Yeah.
if I was in charge of matter balance, I would say, yeah, I would like to start exercising right off the cuff. I mean,
Yeah.
Bingocize does, but
Yeah.
this
Right.
is the way they do it. We have to follow their program.
Right.
Yeah,
Yeah.
yeah.
Well, I think one of the things somebody told me, I've also heard great things about Matter of Balance, And one thing I remember somebody told me was that there's a lot of conversation,
Mm,
perhaps it's in the first two sessions,
yeah,
about fear of falls.
yeah,
That, many of us as we get older, or, when we have Parkinson's disease or what have you, we are more afraid of falling.
yeah.
And, that fear is important to understand and wrestle with.
Yeah, and fear and because it makes us a little bit more safe, but you're right. You hear about other people happening, falling, and like you said, this particular celebrity. I mean,
Yeah,
I had a guy who had a profound fear of falling only because they had a dear friend fall, hit her head, and after a couple of days in the hospital, passed away, and they were going to her funeral like in a
yeah.
few days. So he
Mhm.
was like very conscientious about that. Um, so it is a thing. I know for
It
me,
is a
like
thing, yeah.
I've fallen myself, and so
Yeah,
I notice I'm a little nervous in a crowd because if there's kids running around, I don't want to
sure.
get jostled. So sometimes
Yeah,
I bring my cane, and
yeah,
when you bring your cane or your walker, you will notice that people tend to part the waters and
yeah.
not crowd you as much, and I like it.
Yeah, yeah, of course. Of course. Yeah.
Yeah,
Well, thanks again,
yeah,
Tricia, for joining us and for sharing all about fall prevention
yeah.
and
Thank you for
Stanford's great
having me.
programs. Yeah, I appreciate it so
Yeah.
much. Yeah. Thank you.
Okay,
And we'll
thank
see
you.
everybody next month. Okay.
Okay. You have
Okay.
a great rest
Bye-bye.
of your day. Bye.
Okay. Bye-bye.